My name's Hazel Allaway. I'm a speech and language therapist. I work locally for Birmingham Community Healthcare. And I have been working for the past year with Sarah Jane to undertake a systematic literature review. And yeah, she asked if I would come and talk to you this morning. Yay. Okay, so how did it all start? Well, it started, I work in language resource bases across the city with children who have specific speech and language disorder. As part of my job, I'll go and support my colleagues if they've got a case that they just want a bit of help with, or about where to go next. And I went out to one of my colleagues and they asked me a question and I didn't know the answer. And it was, well, if I work on a child's expressive language disorder in English, which is what we do as best practice in our area, does that carry over into their home language, or do I have to work on the same grammatical structures in their home language? And I went, I don't know. So I then thought, so how do I find the answer to this question? And then it just so happened that BCHC were running a series of workshops on research at Aston University. So I thought, oh, great. So I asked my boss, can I go along? And that was a few Thursday mornings. And they, talked through about how you would do a research project. And then you could win 5 hours of one-to-one mentoring on your to help you with your proposal. So you had to write a proposal, go for an interview to see whether you could win this mentoring. So I cobbled together a bit of a research proposal of what I wanted to do, and then really the people that I met with said, I think what you need to do first is carry out a literature review. You've got to find out what's out there. And then they put together a little package. This is the research and development team at BCHC, put together a little package linking me up with our library, in-house library, and then they linked me up with Sarah Jane Jones at BCU to help support me with that. Really, I didn't know what I was letting myself in for when I started this. I was really quite very enthusiastic, but very naive, because a systematic literature review is is referred to as it's original empirical research, which reviews, evaluates, synthesises all the available primary data. So it's actually really quite big, and it was at the top of your pyramid, wasn't it? So yeah, I felt good after looking. Thought, wow, I haven't got there yet, but it is at the top of the pyramid. And it is aiming to identify and find all the available literature on a topic. So finding that, but then in the literature review, can't say it, how sad, because I'm going to have to say it quite a few times through this. You go through actually sort of clear explanations of how you've undertaken it, with the idea that anybody can come along and replicate it. So yeah, you start with a clear research/review question, and then in the review you have your aims and objectives, you have a methods section, a results section, and a discussion, and a conclusion. So it is very much like a research paper, that you might carry out on primary research, and with the key being that it is easily repeatable. I can see some people writing down. Do you want me to leave it for a bit or go on to the next slide? You okay? No? Fine. So I started with a clear research question, and I wrote down because I can never remember what PICO stands for. I should throw it out to the audience, because I've got people who are much better at this. So I started with who my population was, bilingual children with specific language impairment, what the intervention was, sort of therapy, comparing it with, say, bilingual children who didn't have specific language impairment, or just children who are not bilingual and don't have a language impairment, and then, you know, what your outcome is. I mean, this afternoon, you'll be going into more detail. I'm looking at the guys that are running, be going into more detail, I think, about that this afternoon. So yeah, I used there's lots of things I used, this search straws, which just helps you pull out your key concepts and then go into, again, this is something this afternoon, if you're going to the library, talks about how you set up your question and how you input that information to get the best information, the relevant information for your literature search, so that you are finding all the key relevant information out there. So, comprehensive and thorough search. That's what you have to start with for a literature review. So I feel very much what I've learned, it's kind of who you know as much as what you know. So started off, the first link I was given, it was to my local, not my local library, but within work, within BCHC. And, you know, linking into the Athens database, log into, you get a login, so that I can now always sort of access Athens. You've got your library staff, certainly, I'm sure it's the same, you know, for where you all work, but actually I could, if I wanted, give my sort of literature search to the library staff, and they will carry out the literature search for you and then send you back your list of articles. And then there's an awful lot of e-training courses on our, I know it's they are on our intranet, but I'm sure it's the same, you know, for where you work, that talk you through, walk you through really how to do literature search. That's just sort of explaining what sort of the base library and the Athens database is. You know, with the Athens database in the NHS, it's who the NHS decide to have on their database as to what you can research. I mean, I sort of say this is kind of a key theme I want to get across. It's making those connections, and I, you know, was very lucky to have the support of Sarah Jane to conduct the database search, and because we were able to search using BCU's databases, they actually have a much wider range, and we could access some of the educational databases, which I can't access just through the health service. And certainly a profession like speech and language therapy, we straddle health and education, and actually there is a lot of, I can see the speech therapist nodding, you know, so there is actually a lot of useful research also within the education sphere. So you know that was incredibly useful, and I couldn't have done that without having those connections. So the next stage of the literature review, I've got a lovely wad of A4 sheets with just titles, and then I had to decide which ones I was going to include and which ones I was going to exclude. It's a three-part process. First of all, I excluded by title, just so if it didn't mention that they were bilingual children with specific language impairment, or it wasn't therapy, then, you know, that wasn't my key question, that wasn't what I was looking at, so they were just taken away at title. It was then the ones I was left with, you know, look at abstract, then the ones that I was going to get by full article. So as I say, they needed to include that they were bilingual children with a diagnosis of specific language impairment. There had to be a therapy intervention for language, and we wanted to compare and progress the effect in both languages. So there was 599 citations that came up. 307 of those were excluded by repetition by the computer. That was just done. So that meant I had 292, which I reviewed at title. That then left me 94, which I had to read all the abstracts. Then had 16 papers, which I had to read in full, and at the end came up with six relevant and appropriate studies. Believe me, that was more than we thought we were going to get, wasn't it? Because it's quite a niche question, really, that I was looking at. So anyway, the lucky 6. We decided to include all the relevant research papers, because if you look at some of the literature on carrying out a systematic literature review, and going back to your pyramid, which we had the systematic literature review at the top, and then one below was like randomized control trials, and then going on down what's seen as the best. And I think a lot of systematic literature reviews will just look at, say, include randomized control trials. I'm looking at Sarah Jane, seeing if she's going to nod. Is someone going to nod at me? Yes, nod at me. We'll just include those. But because we found 6, we thought we really want to include all of it. But actually, 4 were randomized control trials. We were quite amazed. So we're still in the process, aren't we, of assessing the papers and pulling out sort of all the data. And I say I'm a working speech and language therapist. I work 4 days, have a day, but it's quite cram full. And I have been doing this. I got 5 hours, and I think I'm probably sort of jumping ahead, but it is hard alongside work. I'm sure, Josh, you would do say the same, and then, which, so it is slow. I haven't got sort of, oh great, I've got 2 months and I'm going to do this and I'm going to focus totally on it. It's done, Sunday afternoon before I'm meeting Sarah Jane, because I suddenly think, oh no, I haven't done what she asked me to do. So it's exciting and it's interesting, but I'd be lying if I didn't say it was hard to do it alongside work, really, and all the support is absolutely invaluable. So what have I learnt as the process, really? I feel it's actually been invaluable, and I am much more passionate now about sort of evidence-based research, and I think I was amazed what was out there, really, and have sort of gone on to go, oh, I've got another research question about stammering in children with SLI. Let's just do a quick literature search. Let's see, not a systematic one, I hasten to add, just a literature search, and find out what the evidence is. Fantastic, there's quite a bit out there. Let's integrate that into we use packages of care at work to work with our children, and let's get that evidence into that package of care. So then the best practice, is happening throughout our department. Learned what a PICO question is and how to do one of those. Really good. I have learned how to conduct a search. I will confess, I really was very much start of the journey. I really was quite naive and new to all this, and can now find those key research papers within a field of interest, which is great. And again, I said I'd come back to this. I think I feel really strongly it's the key thing is making those connections. And I want to call you Judy, but it's Lucy, isn't it? And Lucy was sort of saying at the very beginning about how BCU can, sort of help and support and make connections with us. And that's why I've got it in a big circle in the middle, because I do feel that absolutely key. The other big thing is time. Said it takes an awful long, it does take a lot of time. But, you know, I've had my manager's support, my colleagues' support, and that, you know, I feel is really key. You don't just, you know, want to work along on, I'm sure you say the same, on you know, you want your team behind you to support you and say, oh, well, I kind of want them to be as passionate as me, but to sort of come along with. And it's brilliant CPD. You know, we've got to do it, but actually it's, you know, it ticks those boxes without even having to think about it, really. So, you know, what support is out there for us to do that? I mean, we've got a research and development team within our trust. I'm guessing, you know, that most trusts do have. I'm sure, yeah, people are nodding. You know, and actually, I think they'd be absolutely thrilled, you know, to hear from you and to support you if you know, if you wanted to try and get some research off the ground. As I say, the trust library, you know, I'm sure, I'm sure, you know, again, you've got them in your trusts and they will carry out those literature searches for you. And they'll also, you know, and help you source the journals and you know, and the articles. So actually, you know, less time than doing it all yourself, but a really good resource. And as I say, there's the how-to tutorials on your, you know, on your intranet, and they will, as I say, really step by step. This is how you do it. I would urge you all to go away today if you haven't and open up an Athens account. You know, once you've kind of got your login, it really is quite easy to go in there and start that little search and find all that fantastic information. I'm going to say your college. Certainly know the Royal College of Speech and Language Therapists. I mean, we have a journal collection, and you know, we have a research champion, and I'm looking at you. Key player over there. You know, they provide a critical appraisal tool, and I know they're working very, very hard for our profession to try and get access to more and more journals, because that is quite a key thing, really. It's kind of fine to go, actually, I found these 6 articles. You might be lucky, you might find more in your search, but you know, how do I access them? I've got access to that journal, but oh, crikey, I've got to pay 25 quid, you know, for that one. So it's great. So I think the work that's being done to try and get us much more access. We kind of mentioned Twitter earlier, but certainly in our profession, quite often, if you're following the discussions, people will kind of go, oh, this article is now free to access. We've argued to have this free access for, you know, a week or what have you, and you can kind of go, oh, great, yeah, you know, access that. So I think people are trying to get information out there. And then, yeah, sort of looking at them like our council for allied health professionals, those of us who are there, also, you know, they're sort of doing quite a lot of research out there and trying to support us with that. So yeah, thanks for listening. Thanks for listening. Any questions?